Psychological Analysis, A Beautiful Mind by Maegan, Burrier, Sabrina Hernandez, and Carlee Coonrod.
A Beautiful Mind takes place at Princeton University, located in New Jersey, and then later MIT and Harvard University, which are in close proximity to each other. Culture of setting. The schools and people Nash are surrounded by are all extremely smart and typically reserved, quiet people who do not try to understand or get to know others. Main character is John Forbes Nash Jr. Background. This film is set in the 1950s and onward, focusing on John Nash, a brilliant yet awkward mathematical scholar who is attending Princeton's graduate program for mathematics. This film follows Nash through his life dealing with schizophrenia, a mental disorder that causes disturbed thinking, emotions, perceptions, and behavior.
John Forbes Nash Jr. was diagnosed with schizophrenia. This is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It is able to cause individuals to interpret reality abnormally while also seeing and hearing things that are not real. Cultural context. Princeton, MIT, and Harvard are full of reserved, introverted men and some women who are extremely intelligent. Therefore, the fact that Nash was also very focused only on his studies, stayed to himself, and did not socialize much with others. It took a long time for anyone to understand that there was something wrong, which his wife discovered after marrying Nash. Diagnosis. Schizophrenia had just become a more known disorder in the 1950s with the availability of the first known antipsychotic drug for schizophrenia, chlorpromazine. This drug would have been available to Nash due to his stay in the psychiatric hospital occurring during the end of the 1950s. In the movie, Nash is diagnosed correctly and his delusions are revealed to him. One of these unreal beings is his Princeton roommate, one of the only people who Nash is comfortable socializing around during his graduate school.
Schizophrenia in different cultures and stigmas. In different cultures, schizophrenia is seen to be understood in all cultures, even though the name was given to this disorder may not match schizophrenia. It is hard to diagnose schizophrenia due to the many mental, mood, and personality disorders that must be ruled out first. There is also a blockade between cultures due to some of the symptoms not existing in other places, like remote Africa. The different names given to this disorder also cause it to be treated differently due to the cultural ideas. Common stigmas. People living with schizophrenia are dangerous and violent. Everything people with schizophrenia say has no meaning or is not real. People with schizophrenia are unpredictable.
John Nash and schizophrenia. Symptoms displayed by Nash. Delusions. Nash has many delusions throughout the movie that are not based on something that is occurring, like when he imagines and believes that he works for the Department of Defense to protect America from Russian spies. He even visited the Pentagon to crack an impossible case. Nash has many people in his life that are hallucinations, including his best friend Charles, Charles's niece Marcy, and a Department of Defense agent Parcher. He sees these people constantly throughout the movie and has full conversations and experiences with them, yet they turn out to be completely made up, which we discover after Nash's visit to the psychiatric ward. Symptoms not displayed by John Nash. Aggression. The only time Nash was truly aggressive throughout the movie was at the very beginning, where he pushed down Charles, his roommate, who does not exist, simply because he made him mad. The only other time was when he accidentally bumped into his wife Alicia and their child while he was trying to protect them from Parcher, who Nash believed was trying to kill them.
Treatment. Treatment is usually lifelong and often involves a combination of medication, psychotherapy, and coordinated specialty services. Our proposed treatment plan. Combination of medications and treatments that work hand in hand. Antipsychotic and anti-tumor medicated drugs. Antipsychotic reduces or improves the symptoms of certain psychiatric conditions. This type of medication includes chlorpromazine, haloperidol, and clozapine. Anti-tremor. Helps control tremors, shaking, and steadiness. This type of drug includes benztropine. Therapies and treatments include support groups, rehabilitation, and cognitive therapy. Why this treatment plan is appropriate. The medications and therapy work together to treat schizophrenia due to the drug's ability to stabilize Nash's mind and keep his hallucinations to a minimum, while the therapy treatments will improve his mental health and keep Nash responsible for his actions in taking his medications due to peer pressure.
Part 2. Ethical concerns for the treatment. Psychoactive drugs have negative side effects. People respond to antipsychotic medications differently, and they usually take about 6 weeks for the full effect to actually work and for the hallucinations to be in complete control. Psychoactive drugs are capable of causing syndromes that can have negative effects on the body. Neuroleptic malignant syndrome, high fevers, sweating, swings in blood pressure, and muscle stiffness. Tardive dyskinesia causes random muscle movements such as facial grimacing, lip smacking, and eye blinking. Situational, cultural, and societal barriers that can hinder the treatment. These antipsychotic drugs were in their early stages, so access to them was slightly limited to the overall public. The medications were also ethically challenged because of the enhancement of normal behavior was still being explored.
Portrayal of schizophrenia. Accurate portrayal of disorder. We strongly believe that this film accurately portrays the mental disorder of schizophrenia for multiple reasons. John Nash exhibits almost all positive symptoms of schizophrenia by experiencing those such as auditory and visual hallucinations. Nash also suffered from disorganized thoughts and speech. Throughout the movie, Nash's personal rooms were shown as time progressed, and it was always filled with magazine cutouts and a combination of words and numbers that Nash spewed from his mind onto paper. How does this portrayal influence our thinking? Nash portrays a side that is not just violent, aggressive, and unpredictable like the stereotypes that most people tend to assume that those with schizophrenia possess. He helps us to have an empathy for people who deal with this disorder on a daily basis instead of simply looking down on them. This movie has aided in ridding society of the bad stigma surrounding those associated with schizophrenia.